Good morning to you. I hope I'm not much of a morning person myself, so for those who are not, I commiserate with you a little bit. But I think what we've got for you today is a message that actually Dr. Kelly Nelson from Duke is here to deliver. We'll wake you up a little bit. It's always great to come back to St. Mary's. Like Katie said, I do have a little bit of a history here. Presently, I'm with the North Carolina Medical Society, which is a couple of blocks, actually a couple of miles just east of here, just behind the Governor's Mansion. And in my capacity there, I serve as the Executive Director of the North Carolina Dermatology Association. Our organizations primarily deal with the day-to-day health policy issues down at the legislative building, with state agency and government implementation of healthcare reform and those kinds of things. And we rarely have the occasion to come out and deal with public education as much as we would like to. So this is a great opportunity for us because these are issues that affect everybody's lives every day. And so this is a great opportunity for us, and we do appreciate the welcome to come over. Even Emily were students here back through 2006 and 2008. I think this, y'all can tell me, was this a ring? I think it was right over here in the cafeteria one day, one evening, I guess. But as a family, we have quite a history here. My wife, St. Mary's girl, her mother and her grandmother, and even my sister. So we have a lot of memories here. And I even was married in the chapel with Jeanette and I were married back in 1985. Don't tell her I stumbled. I'm not a morning person. But we do have a lot of memories here, and I was thinking about getting prepared for today. One of my most memorable experiences was sitting back there in the back row. I guess it was an afternoon or morning when Thea gave her straight talk message. Are y'all familiar with that? The parents are? Well, and I'm sure it filtered down to you. But Thea's message was it was a very I guess almost in your face message about the realities of where you are as young ladies getting prepared to leave St. Mary's and where we needed to be as parents to help you through that process, and so a little bit of that responsibility, accountability message as we all mature through that, and that included parents. And that resonated with me even today. And so what I was thinking as you leave here today, and whether it's 5 minutes, 5 days, 5 years from now, I hope what you hear today will resonate with you. It is somewhat of a wake-up call. I think there's more and more evidence, and you may have seen and heard it in the media, about some of the dangers of sun exposure and certainly with tanning and some of the latest information about the use of tanning beds. So our goal today is to give you that information so you will have it whether you're thinking about it today or tomorrow. Question for you to start, and you can include yourself in this if you like, but if you know of anybody who has gone and used an indoor tanning facility in the past year, raise your hand. In the past 6 months, leave it up. Past month? Past week? Okay. I mean, so there is quite a prevalence of use of tanning beds, certainly in youth and even into young adults. And what we're finding is a lot of the patterns of youth who use tanning facilities comes actually from their parents may actually do that. So it's part of our culture. So we're trying to educate not just certain segments of the age populations, but actually through all of those. Another question for you: how many of you, and you can include yourself in this certainly, have used the spray tanning alternative? Good. Okay. Because there's some question about that. About the health aspects of that, and so far we've not been able to determine any unhealthy component to doing that. So today, just to put it into some perspective for you, and you think back 1930, 1 in 1,500 had a chance of getting melanoma. 1980, 1 in 250. 2011, 1 in 74, and projection in 2015 is 1 in 50. So you see where we're headed with the numbers. So I think as you age, the likelihood is certainly going to increase. It was just, I think it was yesterday, the Wall Street Journal. I wrote a note Skin Cancer Foundation said that now it's 1 in 5 Americans will develop some type of skin cancer. So you think 1 in 5, you've got a student body of what, 246? You know, you do the math. I mean, you can look at your neighbors and you think about the likelihood. It is increasing. So, you know, one of the things we want to leave you with today is, you know, tanning is temporary, but the damage can be permanent. So please keep that in mind. Most common form of skin cancer in young adults between 25 and 29 years of age, melanoma. 25 to 29 may, to you, seem like you know, a long way off. When you're 25 to 29, think back, you will think you were just sitting in these seats. So it is upon you right now. Indoor tanning, studies have found that 75% increase of melanoma for those who have experienced indoor tanning. The UV irradiation in tanning beds can be up to 15 times greater than the sun. So sometimes I think the mindset is if I'm in a tanning bed, it's just like being out in the sun. Well, that's not the case, but the intensity can be far greater. And then you know, one of the most startling facts is even one visit to a tanning bed can have the result that we certainly don't want to see, and that's the increased incidence of melanoma. That's when you go see Dr. Nelson. So I want to turn it over to her. She has the key message for you today. Dr. Kelly Nelson is here from Duke. She's assistant professor of dermatology there at Duke. She did her medical school training and residency training at UNC. So I will let her tell you what her favorite shade of blue is. I'm not sure.
Good morning. How are you guys doing? You all awake? Can I get a good morning? Good morning. Yeah? Okay, thanks. Well, I really appreciate the opportunity to come and talk to you guys a little bit about tanning and about skin cancer both. So, one of the things I think is really interesting is that even though we all look so different from the outside, our skin really responds the same way to sun. Now, obviously, as you guys can imagine, the little girl here on the far left is definitely going to burn more easily than the girl there on the far right. But the impact of sun on our skin is still damaging, even for those of us who are on the far end of the pigmentary spectrum. The other point that I'm going to make is that all of us are at risk of developing skin cancer, even those of us who are of Asian and African descent. So let's get started here. So this is a cross-section of your skin, okay? You can see the very top layer there is the epidermis. This is what everyone sees when we look at our skin. The next layer down is the dermis, which is kind of this lighter pink color. And then down below that is the fat, which is the normal layer right underneath all of our skin that helps insulate our skin and regulate our body temperature. Now, when you look in the epidermis, it's made up of different cells, okay? And these cells are the keratinocytes. That's what makes up the vast majority of our skin, that outer layer that we look at. But then we also have melanocytes, which is this blue kind of tendrily looking cell here. And what the melanocyte does is it generates melanin or pigment that it then distributes to our keratinocytes. And it does is there's some basal rate of production of pigment by the melanocyte. That's what gives us our different levels of skin pigmentation. But any exposure to UV radiation prompts the melanocyte to generate extra melanin. What I think is really interesting, so here's what the melanocyte does when it makes that pigmentation. It basically puts it as little hats on top of the nuclei of your keratinocytes. So you guys know the nucleus is where the DNA resides for the cells, right? And so what the keratinocyte is saying, you know what, I'm getting too much radiation, I need to put a hat on my head to protect my DNA, to try to avoid further mistakes in my DNA. And those are the mistakes that cause skin cancer, okay? So it's really, I just think it's so cute that it puts these little hats on top of the nuclei just to protect your DNA from sun damage. And what that means is that any tan is your skin telling you that it's received a hit of radiation, that that's too much radiation for your cells because your cells need more protection. So that's what any tan means to your skin cells. And this is what happens with chronic sun exposure. So on the top, you see the back of the neck is nice and smooth. It's all that same pink color. This is the cross-section of the skin. You can see that the dermis, which is the pink swirly layer there, looks pretty regular and organized. This is what happens with chronic sun exposure. So you guys think about your granddad's neck. It's probably what it looks like. And none of us want necks that look like that, right? I don't want a neck that looks like that. I imagine you don't either. But this is what happens with chronic sun exposure. So when you look at the dermis here, you see that instead of being nice and pink and full, you're now getting this light blue, grainy business. And that's the underlying support level of your skin. When that dermis starts to break down from the chronic sun exposure, that's when you get wrinkles. None of us really want wrinkles. So let me show you another slide here. So this was a really interesting study where a plastic surgeon did facelifts on twins. Okay, so he would do a facelift on one twin and then nothing to the other twin. Whether you think that's good or not, I don't know. But what's really interesting are the before pictures. So these are two identical twins. The twin on the right had a lot of sun exposure during her youth. The twin on the left didn't. So you can see, just from looking at these pictures, that the twin on the right looks older because of the pronounced wrinkling. Her skin pigmentation is a little bit more mottled than the twin on the left. So even from a cosmetic standpoint, these are the effects that tanning has on your skin long term. This is a little different message. These are two twins, one of whom smoked and one of whom didn't. Not really the topic of the morning, but I still thought the pictures were pretty striking. So you guys can tell which twin smoked, right? Which twin? Left, exactly. So even just that simple lifestyle difference can have a really large impact on your skin and how it appears and how your skin ages. So who in here knows someone who's had skin cancer? Wow. Can you guys look around and see how many of you are raising your hands? That's a lot of people. As Alan pointed out in his slides, the rates of skin cancer are getting higher and higher. So when I was doing my residency training at UNC, we worked in student health there. And we had to put in place a new mechanism for tracking skin cancer. Because all of a sudden, we started diagnosing it in undergraduate students and student health, you guys, in just a few years. One of my patients was a field hockey player who also used tanning beds. She was very fair complected. And she came in for a skin check, and I found an early melanoma on the back of her shoulder. She had no idea that it was there. These are pictures of the three most common kinds of skin cancer. Okay, melanoma is the one on the right. That's the one that we're going to spend the most time talking about. But I wanted just to spend a quick minute talking about basal cell and squamous cell skin cancer as well. Basal cell cancer is the most common cancer in white people. Okay? Squamous cell comes in next, and then melanoma is third. And these things, the basal cell and squamous cell cancer, tend to be more of a localized problem. When you develop those, you still have to get them treated surgically, but the chances of them spreading elsewhere in your body are very, very small. Most of these develop in areas of sun exposure. So as you can imagine, you probably wouldn't want one of these on your nose, so you'd have to get your nose operated on. But melanoma is a little bit different ballgame. Melanoma does have the potential to spread elsewhere in your body. And early detection is really key to us being able to cure melanoma. If it's caught early, it's 100% surgically curable. So we do a little surgery in the office, cut it out, sew it up with stitches, and we're done. But when it's diagnosed at a later stage, which something like this is when it's raised up off the skin, the chances of it spreading into the lymph nodes and then to the other organs in the body is pretty high. One of my patients is a former Miss America, and she used tanning beds to get ready for her pageants. And she developed a bump around her ankle, and it grew, and she went in to see a dermatologist, and it was a melanoma. Now, thankfully, it hasn't spread anywhere else in her body. but it was very scary to her, as you can imagine. Let's go forward and talk a little bit more. So I'm going to break away real quick and show you guys 2 quick videos. All right.
My Jamie, she was my baby girl, precious baby girl. My Jamie was a teenager.
We're going to get the sound fixed so you guys can hear what's happening.
I didn't realize how dangerous they were. If you tan when you're young, your risk for melanoma are increased by 75%. That's huge. What I would say to mothers that allow their daughters to tan, no mother should have to visit their daughter in the cemetery. 1 person an hour dies from melanoma. Jamie's hour was at 1 o'clock in the afternoon on Friday, March 16th, 2007. I hope no one else has to mark their hour.
This message is brought to you by the American Academy of Dermatology.
My name is Amanda. I'm 21 years old. I have lots of friends that use tanning beds that lay out in the sun all the time, and I tell them about Jamie. Jamie was in her early 20s when she was diagnosed with melanoma, and she died right before she turned 30. Jamie's death caused me to stop tanning completely. Before that, in high school, I wanted to be dark and look good in a prom dress or a bathing suit. In high school, it was the thing to do. But after Jamie's death, I completely stepped away from tanning beds and never went back. I know now tanning can cause the worst possible skin cancer you could get. People think tanning is safe. I don't think it's safe. You could die just like Jamie did.
This message is brought to you by the American Academy of Dermatology.
All right, so let's talk a little bit about tanning beds. A dermatologist at Wake Forest did this really interesting study. Okay? So he took 2 tanning beds. One bed, he put fake bulbs in. The other bed had regular bulbs. And he had people who tanned regularly to come in and told them they could use either bed they wanted to. Left or right, didn't matter. And after a while, the repeat tanners began to develop a preference for using the one that had the real bulbs. Okay? The one that had the sham bulbs they really didn't want to go into, even though they couldn't express why. They just preferred the bed that had the real UV bulbs. And when he gave them a drug, medication, that blocked the opioid receptor in their brain. Now, the opioid receptors are involved with basically feeling pleasure, enjoying things. When he gave them a medication that blocked that receptor, all of a sudden they couldn't tell a difference between the 2 beds. So there is certainly, for some people, a component of addiction to using tanning beds, just like there's a component of addiction with smoking or with using recreational drugs. Okay? Now, there's certainly some people who don't necessarily have that deep sense of addiction, but I think it is something that I want you to be aware of if you do use tanning beds. Is this something where I am potentially becoming addicted to? This is a patient who came into my office a few months ago. And he said that he had a blood blister on his back that had developed after he was riding a 4-wheeler and a branch hit him on the back. I don't know about you, that doesn't look like many blood blisters that I've seen. And this melanoma had already spread to the lymph nodes under his arm, and he passed away a few weeks later. This is one of my patients who is African American, okay? And she also said that she thought this was a blood blister. And when I talked to her about it, she said this had been here for about 6 years, and it had gotten larger and larger. But the concept of skin cancer wasn't even on her radar. Okay? So with anything with your skin that is growing and changing and isn't going away, I'll get that off the screen for you. This is another of my patients who's African American. This is another melanoma. I don't show you these pictures to gross you out or to scare you, but I do want to make a point that all of us, no matter what the color of your skin is, all of us are at risk for skin cancer. Okay? So when you're interacting with your families or with your friends, just keep this in the back of your mind, that this is something that can be present with your skin, even if you aren't blonde-haired and blue-eyed. Melanoma can also develop around the nail. Okay? So again, this isn't something that we really think about, but it's something that can happen. Now, some streaks in your nails are normal, especially people who have darker pigmentation. But streaks that are particularly wide like this or that are widening is something that should be looked at by a doctor. Now, what should you do? Okay, so I've shown you some scary pictures and talked to you about how sun exposure can cause skin cancer, but it can also give you wrinkles. So what should you do? Every day, it's a good idea to use a moisturizer with sunscreen. Every day, even in the winter. And Olay and Aveeno, you can get things at CVS that work very well, that aren't horrifically expensive. It's a nice thing to incorporate that into your daily routine. Now, if you're going to the beach, I go to the beach with my family, but when we go, we put up an umbrella, I wear a hat, I use SPF 85. My husband is very, very fair-skinned. He does triathlons. He gets coated. He's a very good sport about it. But he gets coated with sunscreen on a regular basis, too. And this is part of our routine when we go to the beach. There are a lot of different goals that you can have in terms of your skin. Some people really want tan skin. For those people, especially my patients, I recommend doing the spray tans or the self-tanner. Absolutely no tanning beds. Okay? I tell my patients, so my practice at Duke in dermatology is all patients who have had melanoma or have a very strong family history of melanoma. I tell my patients if they're going to the tanning beds, then they need to find another dermatologist. Because my time, unfortunately, there's a huge demand. There are a lot of patients who have melanoma. And I want to take the very best care of my patients possible. And having tanning beds in the mix is not part of my game plan for them. So when I see my patients, I ask them what self-tanner they're using. The spray tans look very nice, but they're more expensive. Some people don't really like going and getting things sprayed on their skin. So the lotions, the Jergens Daily Tanning Lotion, especially the lighter color, has a very, very natural tan appearance to it. So if you do want tan skin, I would recommend doing something along those lines. The Victoria's Secret self-tanner, bad. Don't use it. Okay? I do not recommend that one. If you want to maximize your cosmetic outcome, when you're 50 years old, if you want people to think that you don't necessarily look your age, that you don't want a lot of wrinkling to your skin, you don't want a lot of pigmentary change to your skin, then using a daily facial moisturizer with a sunscreen in it is a really good idea. If you want to minimize your chance of skin cancer, then more rigorous sun avoidance is what I would recommend. Okay, so that would be the umbrella, the sun protective clothing, the hat. It's a little bit more rigorous, but different people have different goals. As a dermatologist, someone who sees skin cancer every day, I will tell you that my goal is to minimize my chance of skin cancer. When you hear information from the tanning bed industry, they say things like tanning is natural, that your body needs exposure to ultraviolet light to make vitamin D, and that we as dermatologists are just really overreacting to this whole skin cancer thing. I tell my patients that I still want them to live their life. I still want them to go for jogs. I still want them to play tennis. I want them to play golf. I want them to go to the beach with their family. I want them to do all those things. I want them to be able to enjoy being outside. So my message isn't that you have to become a vampire and never go outside. But my message is that I want you to be careful and thoughtful about the amount of sun exposure and sun damage that your skin receives. Vitamin D is very easy to get from a supplement, 2,000 units a day. It's very, very difficult to overdose from vitamin D. So it's not necessarily that I'm telling you that all sun exposure is absolutely forbidden. Instead, just to be thoughtful about it and not abuse your skin by exposing it to too much radiation in a thoughtless manner. My final thought for you is that if you see a mole that's changing, doesn't seem right, go see a doctor. Okay, so if you see something that seems to be growing, doesn't look like your other moles, just see a dermatologist so they can take a look at it. Because most of my patients tell me that they had noticed their melanoma, but just hadn't really gotten themselves organized to go to a doctor when it could have been diagnosed in an earlier stage. This is my last pitch for the beauty of pale skin. For skin that hasn't been abused with chronic tanning. I am very pleased that that message is now being seen in the media. But if you do want to have tan skin, then by all means use the self-tanner or the spray tans and not the tanning beds. Okay, so that's it. Now, do you guys have any questions for me? No one has any questions? Not a one. Yes? Yeah, so the question was, how do we remove melanoma? So what we do is it's usually done locally, just in the office, unless it's more advanced. And we numb up the skin, we cut it out with a scalpel. We use a margin around the area that we call the therapeutic margin. And that can range from being this much or about this much, all the way around the area. So usually we're taking out an area of skin about like this. And then we send that piece to the pathology lab to be looked at to make sure we got it all. And then we close up that area with stitches. So thankfully for the very early stages of melanoma, that's done in about 20 minutes. Okay? But it leaves scars on people that you can imagine probably about this long. Okay. Yes? So the question was, do spray sunscreens work as well as the self-tanning lotions that you apply? From what I've seen from my patients, they do. They both give a very realistic sun, basically a tanned appearance to the skin. You know, the reason I like the daily tanner is that you aren't as likely to get the streaking and the accentuation because you have to pay special attention to the thicker skin, so around the sides of your hands, your knees, your elbows, and you have a little bit more margin of error if you just do the daily tanning lotion.
She's talking about sunscreen, like the spray.
Oh, the spray sunscreen? Okay. Yeah, thank you for clarifying that. They do work as well. Like any sunscreen, you have to put on enough to get the full SPF. So with the higher SPFs, the reason that I recommend those is that most people don't put on enough to get the full SPF. If you put on half of the full amount, you don't just get half of the SPF, so it doesn't go from 80 down to 40. It's actually in the square root. So you end up getting a whole lot less. So I like the higher levels of sunscreen so that you actually get enough of a protection for being out in the sun. Yes? Yeah, how can you tell when you put on enough sunscreen? For the standard recommendation for an average sized person is 2 fluid ounces for their whole body. So if you think about the average tube of sunscreen is about maybe 10 ounces, you get 5 applications out of that. So most of us put on about half of that. Yes?
Is skin cancer hereditary?
Very good question. So the question is skin cancer hereditary? It certainly can run in families. It's a little bit hard to tease out how much of that is just the level of pigmentation that you inherited from your family. So if your parents are both blonde-haired and blue-eyed, then you're probably going to be very fair-complected as well. We do know that being fair-complected increases your chances of getting skin cancer. But there are families where skin cancer runs in that family. But I will say that just because you don't have any skin cancer in your family doesn't mean that you're completely immune to that risk. Yes?
What do you do if you're allergic to sunscreen?
Okay, so the question is, what do you do if you're allergic to sunscreen? There are some sunscreens that are hypoallergenic. A lot of times people are allergic to the preservatives in the sunscreen, and they can get itchy rashes, get irritation around their eyes, so their eyes kind of sting and burn when they put sunscreen on. And there are products that are more hypoallergenic. And if you Google hypoallergenic sunscreen, you can get linked into some of those products. Any other questions?
Down there.
Yes. So the question is, what does it mean? What does that really mean when you have melanoma? With melanoma, there's a whole spectrum to the disease. The earliest stage of disease is called melanoma in situ, which is just in the very top layer of your skin. The survival from that is 100%. But if you're diagnosed with a later stage of melanoma, like my patient that I showed you with the big thing on his back, then that can spread to your lymph nodes and can spread elsewhere in your body. When we think about cancer, usually cancer implies that it can spread elsewhere in your body, like lung cancer can spread elsewhere in your body, brain cancer can. And so it's really that impact to your other organs that can eventually cause you to pass away. And if melanoma is diagnosed later, then that's what can happen. Yes?
Is there really a difference with SPFs in sunscreen?
Is there really a difference with the SPFs in sunscreen? If you're using the full 2 ounces, like we talked about before, there's starting to be very subtle differences as you get above SPF 50. But the challenge is whether you're using that full amount. I will say that an SPF of 4 really isn't worth a whole lot, truth be told. So to get meaningful protection, you want to be looking at least an SPF of 15. And my preference would be that would be just for daily walking around use, but if you're going to be out at the beach, that you're using at least a 30, and preferably more. Yes?
I've heard people only putting sunscreen on SPF on rashes and moles.
Right. So the question was, what about people who only put sunscreen on individual freckles or individual moles to try to protect those from becoming skin cancer? Does that work? And about half of melanomas come out of existing moles, and the other half come out of normal appearing skin. So you may be slightly reducing your risk by doing that, but it's not going to protect you from the aging effects of the sun. And it's not going to protect you from those other melanomas that could develop within normal appearing skin. That's a good question. Yes? Is tanning oil protective? So most tanning oils, if they have SPF, it's usually around an SPF of 4 from what I've seen, or 15. It's really dependent on the SPF. So if it has an SPF of 15, then that would be equivalent to a cream or a spray formulation with that same SPF. Yes? So do you have to have a mole for skin cancer to develop, or can it come out of a freckle? It can come out of either one. The freckle type of skin cancer tends to happen when you're much older, in your 70s or 80s, but it can happen. But if you have freckling, what that means is that your body is at slightly increased risk of skin cancer, because the freckling is saying that your skin is a little bit more sensitive to sun exposure than someone who doesn't freckle. But it isn't necessarily the individual freckles that increase your risk. Okay. Yes?
Can you get skin cancer from not tanning, from
Right. So can you get skin cancer from not tanning? Is that right?
Yeah.
It doesn't seem to be the case. One of the big questions is around vitamin D. So if you're not tanning, if you're really protecting yourself from the sun, then your vitamin D levels could get a little bit low. And there's a whole lot, that whole story around vitamin D and cancer isn't very clear. But I do recommend that all my melanoma patients take a vitamin D supplement to make sure their bones stay healthy. So vitamin D is definitely tied into keeping your bones nice and strong. But you can get that from a pill, not from tanning. Any other questions? Yes? So the question is, why do you get freckles where you burn? Is that right? So freckles are another sign that your body is getting some sun exposure. Some people have freckles at baseline. That's just how they are. That's how they come into the world. But for some of us, freckles can come and go. So freckles, if I go out in the sun, I get freckles all across my nose and my cheeks. And those are in response to the sun exposure itself. And it's along the lines of the slide that I showed of the UV exposure and the little protective hats that your skin cells are putting on to protect their DNA. Yeah. The vitamin D pills are very cheap, so you can get a 2-month supply for about $6. Any other questions? All right. Well, I really appreciate the opportunity to come and talk to you.